Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about morphological characteristics of reactive lymphocytes, immunoblast, and plasmacytoid lymphocyte. Peripheral blood lymphocyte atypia refers to abnormal morphological features of circulating lymphocytes observed on a peripheral blood smear. Lymphocyte atypia can be induced by reactive or neoplastic causes. Peripheral blood lymphocyte atypia is hard to define due to its variability and significant overlap between reactive and neoplastic conditions. Evaluation and interpretation of an atypical lymphocytosis requires examination of a representative population of lymphocytes, as the distinction between reactive versus malignant lymphocytosis is often made on population characteristics rather than individual lymphocyte characteristics. Reactive lymphocytes are the result of complex morphologic and biochemical events that occur as lymphocytes are stimulated when interacting with antigens in peripheral lymphoid organs. Lymphocyte activation results in the transformation of small resting lymphocytes into proliferating larger cells, which spill into peripheral circulation. The morphologically identifiable forms of antigen-stimulated lymphocytes include the reactive lymphocyte, reactive immunoblast, plasmacytoid lymphocyte, and plasma cell. Reactive lymphocytes are usually associated with viral, bacterial, and parasitic infections, drug reactions, autoimmune and inflammatory conditions, and stress and immune stimulation. Lymphocytes with reactive morphologic changes have been described using various terms including reactive or atypical lymphocytes, Downy cells, activated, variant, effector or transformed lymphocytes, and Tork cells. Atypical is probably the least suitable term to describe the reactive lymphocytes, because it implies that the cells are abnormal when in fact, the lymphocytes are reacting to antigen in a normal manner. While subclassification of reactive lymphocytes is not routine practice, reactive lymphocytes may be subcategorized as Downy type 1, 2, or 3 cells, which refer to the specific forms seen in infectious mononucleosis due to EBV. Atypical lymphocyte is the general category for activated or reactive lymphocytes, while Downy cell is a specific well-defined subtype particularly associated with infectious mononucleosis. All Downy cells are atypical lymphocytes, but not all atypical lymphocytes are Downy cells. The most common morphologic changes and alterations in reactive lymphocytes include pleomorphism and cell heterogeneity, increased cytoplasm quantity and basophilia, presence of azurophilic granules, pale Golgi zone and cytoplasmic vacuoles, variation in nucleus size and shape, and reduced chromatin condensation and presence of nucleolus. The key distinguishing feature of reactive lymphocytosis is cell heterogeneity, including a range of cell and nucleus sizes and shapes, as well as chromatin patterns. All of these changes are present in the same smear. Careful examination of many fields is essential to recognizing this important feature. Heterogeneous population of lymphocytes with various shapes and sizes in an 8-year-old girl with infectious mononucleosis. Reactive lymphocytes exhibit increased amount of basophilic cytoplasm that may vary in intensity within and between cells. The cytoplasm is pale blue to deeply basophilic and may stain unevenly. The cytoplasm may partially surround adjacent erythrocytes, and a more darkly staining peripheral cytoplasm occurs. Peripheral blood films showing azurophilic granules in reactive lymphocytes. Peripheral blood films showing Golgi zone and cytoplasmic vacuoles in reactive lymphocytes. Peripheral blood films showing reactive lymphocytes with a nucleolus. Immunoblast is a large round or oval cell, around 20 to 30 micrometers in diameter. The cytoplasm is deeply basophilic, usually non-granular, and sometimes there are a few vacuoles. The nucleus is round or oval with delicately open, or reticular granular chromatin, in which there are one or more prominent pale blue nucleoli. Sometimes the chromatin is denser and the nucleoli are not visible. Plasmacytoid lymphocyte is a medium-sized lymphocyte with moderate amount of cytoplasm and deeply basophilic. The pale Golgi zone is absent or indistinct. The nucleus is round to oval and slightly eccentric with irregularly clumped chromatin, and no prominent nucleolus. Plasmacytoid is a morphologic term and does not imply cell lineage. Plasmacytoid lymphocytes are named for their resemblance to plasma cells. Downy cells are classically associated with infectious mononucleosis due to EBV and are divided into three types, type 1, 2 and 3. Downy type 1 is a small to medium-sized lymphocyte with plasmacytoid appearance, basophilic cytoplasm, round to oval eccentric nucleus and condensed chromatin. Downy type 2 is the most common type, a large cell with abundant basophilic cytoplasm easily deformed by the surrounding erythrocytes, irregular nucleus, and less dense chromatin. Downy type 3 is immunoblast-like and large cell with plentiful basophilic cytoplasm, more immature irregular nucleus, reticular chromatin, and prominent nucleoli. Large reactive lymphocytes are sometimes difficult to distinguish from monocytes. Morphological characteristics helpful in differentiating large reactive lymphocytes and monocytes are listed in the table. Composite image of some large reactive lymphocytes and monocytes for comparison. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.